The recent years at the Royal Free have been really interesting. I think we've achieved quite a lot. I look on it as three broad periods actually. Firstly, there was something about dusting down the strategy, thinking what do we really need to do to deliver great services to our patients, give our staff great jobs, and ensure that we're doing something about working with others to improve the health of the local population. The next stage was about getting the governance right, and what that really meant was us working our way through a foundation trust application. Finally got there in 2012. Very soon Barnet and Chase Farm hospitals to the north of us started to look for a partner, so we entered into a process of an acquisition which went live about 18 months ago. We're the 6th largest trust in the NHS now, so it's been quite a journey over that period of time. The experience of staff and the experience of patients, and as we know those two things are related, I always read out the friends and family test results. This month I think we had a sample size of just over 6,000 patients, and nearly 9 out of 10 said they'd be likely or extremely likely to recommend both the A&E and the inpatient services to their friends and families, and I feel really proud about that. We've seen the level of staff engagement and staff satisfaction really improve and shift over the course of those 5 years. We did a big listening exercise where we spoke to a lot of patients, we spoke to a lot of staff about what was important to them, and on the basis of that we developed a set of core values which underpin the way we work across the organisation. They focused about being welcoming, about being respectful, about communicating effectively, and about being reassuring. Our ambition is to have an organisation that is clinically led and excellently managed, because actually having clinicians fully engaged and in leadership positions within the organisation is absolutely fundamental to what we do here. The Health Services Journal has actually always been part of my life in the NHS. I used to read it every week and now I read it every day. Every day I'm looking at the computer, looking at the web feeds, so it's very, very much part of my routine professional life. It informs my day-to-day work. How does the HSJ actually make a difference out there? How is it helping my people perform to the optimum of their potential? Well, again, for me there is something about being absolutely the leading edge of thinking and knowing what's going on, and it does give them the information that they need. It does enable them to quite rapidly share good practice. This article on safety, this article on patient engagement, this article about how Trust A or Trust B has made a real impact on bullying, harassment, or reducing infections associated with sepsis. So it rapidly signposts good practice. It does encourage people to talk about what's going on. So again, it provokes that thinking, it provokes that dialogue, it promotes that spirit of inquiry, which is fundamental to organisations such as this.